Welcome to the wonderful world of healthcare, where 10 years of medical school meets patients who think WebMD is a degree. We've scoured hospitals, clinics, and the internet's strangest corners to find the dumbest, pettiest, and most absurd complaints ever made against doctors and nurses. From fashion critiques in the operating room to emotional trauma caused by beige walls, these are the people proving that entitlement is the deadliest disease. Let's scrub in and count down the 56 dumbest complaints about doctors and nurses. 1. A patient awaiting heart surgery filed a serious complaint because his surgeon wore bright red sneakers instead of black leather shoes. He claimed that someone responsible for cutting open a human chest should dress like a gentleman, not a gym trainer. When the nurse explained that comfortable shoes help surgeons stand for hours, he became more offended, saying, "Professionalism is about appearance, not arches." He wrote that he could not trust a man who dressed like he was about to jog instead of save a life. The complaint ended with the demand that the hospital enforce a formal footwear policy for all medical staff. 2. After getting an MRI scan, a man stormed to the front desk demanding a refund because he said the machine did absolutely nothing. He complained that lying in a loud tube with no visible effects felt like a scam. He said real medical tests should make him feel something, at least a little shock or a vibration. When the nurse explained that the machine uses magnetic imaging, not sensations, he said science without sensations was just expensive imagination. He later added that the hospital should provide free entertainment for people forced to pretend to be sick statues. 3. A woman recovering from tonsil surgery filed a complaint claiming her doctor lied about the reward. He told her she could have ice cream afterward but never mentioned it would be plain vanilla. She said the lack of flavor ruined her recovery and called it emotional negligence. She wrote that a real professional would have provided chocolate or at least sprinkles to help her heal faster. She argued that bland ice cream was a cruel betrayal of medical trust and suggested the hospital hire a dessert consultant to ensure patient satisfaction. Staff later reported she brought her own toppings to the follow-up appointment. 4. One man called the hospital's billing department furious that his itemized invoice used Times New Roman font. He claimed the font choice made his massive debt look cheap and unprofessional. He wrote that an institution dealing with human lives should use a dignified typeface like Garamond or Baskerville. He said the lack of typographic taste added insult to financial injury. The billing staff were so confused they checked if it was a prank, but he was completely serious. His final line read that if the hospital insists on bankrupting him, they should at least do it in style. 5. During a vaccination drive, a patient refused his flu shot after seeing the needle sparkle under the light. He announced to the entire waiting room that it looked too shiny to be safe and probably government technology. He demanded a matte finish needle, saying glossy metal felt suspiciously high-tech for medicine. The nurse tried to explain that all needles are stainless steel, but he waved her off and shouted that dull tools are honest tools. He left the clinic proudly declaring that he was not fooled by decorative injections. The nurse reportedly needed a coffee and a deep sigh afterward. 6. A woman furious about her post-surgery scar filed a written complaint accusing her surgeon of cosmetic malpractice. She claimed that she was never told the incision would leave a visible mark and said she believed modern surgery should be invisible. She compared the scar to vandalism on her body and demanded either laser removal or a refund for emotional distress. When told that cutting skin naturally leaves a mark, she said good doctors would find a cleaner way. Her closing line stated that if the hospital insists on leaving evidence of their work, they should at least sign it artistically. 7. A man who broke his arm complained that the cast was defective because his arm still hurt. He said the staff clearly gave him a low-quality model and demanded a replacement that worked properly. He insisted the cast should instantly remove all pain upon installation. The nurse tried explaining that the cast holds the bone still while it heals, but he interrupted, saying he didn't pay to feel anything. He waved his immobilized arm and accused the hospital of false advertising. When asked if he took the painkillers, he said he didn't need pills, he needed better craftsmanship. 8. After a successful appendectomy, a woman demanded to see hospital management because her new belly button scar was asymmetrical. She argued that she used to have perfect symmetry and the doctor ruined her aesthetic balance. She wrote that she could no longer wear crop tops with confidence and that the surgeon should offer free plastic surgery to restore her previous design. She attached photos of her old and new belly buttons for evidence and underlined the phrase "personal tragedy" twice. The hospital's legal team debated for hours whether to respond or just quietly frame the complaint as modern art. 9. A new mother angrily confronted her obstetrician, saying her newborn did not look like the ultrasound photo. She accused the hospital of false advertising and demanded to know why the baby's nose was different. She said the blurry 3D image promised more defined facial features and felt betrayed by the real product. She compared it to ordering online and receiving a defective item. When the doctor explained that ultrasound images aren't exact, she said excuses don't change disappointment. She ended her complaint by suggesting hospitals should include a disclaimer that babies may vary from promotional previews. Staff laughed, then cried. 10. One patient called the nurses unprofessional because they didn't spend enough time chatting with her after checking vitals. She said they treated her like a task, not a person. She expected emotional support and conversation about her family drama. When the nurse said she had to care for other patients, the woman accused her of lacking empathy and demanded a refund for the cold attitude. She wanted a medical professional who also doubled as a therapist and tea companion. Her feedback form ended with the suggestion that nurses should be graded on warmth, not efficiency. The staff simply nodded in silence. 11. An elderly woman filed a written complaint that her male nurse was too handsome. She said his perfect jawline and kind smile made it impossible for her to focus on her symptoms. She claimed his presence elevated her heart rate and caused unnecessary emotional turbulence. She demanded that the hospital assign her a less attractive nurse to avoid what she called medical distraction. When asked if she wanted to change rooms, she replied she didn't want to leave, just wanted him to wear a mask at all times, for safety reasons. The nurse reportedly blushed so hard another patient asked for oxygen. 12. A man recovering from knee surgery filed a complaint because his hospital TV remote didn't have a Netflix button. He wrote that being forced to navigate manually with arrow keys caused unnecessary stress during his fragile recovery. He said if hospitals expect patients to heal, they should at least offer modern entertainment. He ignored the fact that his surgery had saved his mobility and instead focused entirely on technology disappointment. His feedback suggested hospitals should prioritize streaming accessibility for emotional stability. The surgeon read the letter out loud in the break room and nearly choked on his coffee laughing. 13. After being told to fast. Before morning surgery, a man became furious when his procedure was postponed because he ate breakfast anyway. He defended himself by saying he only had healthy food like avocado toast and a green smoothie. He argued that the no food rule obviously meant no junk, not no kale. When staff explained that even healthy calories can be dangerous before anesthesia, he rolled his eyes and said the medical field needed to get with modern nutrition. His complaint concluded that hospitals discriminate against people with balanced diets. The anesthesiologist needed a deep breath before the next patient. 14. A woman visiting the ER for a mild cough complained that her doctor dismissed her self-diagnosis from the internet. She said she was sure she had a rare glowing fungus from the Amazon rainforest because an online forum told her so. When the doctor diagnosed her with simple bronchitis, she accused him of being arrogant and unwilling to accept patient-led science. Her written complaint said the doctor lacked curiosity about her unique biological condition. When told she could get a second opinion, she said she didn't need one because she already had Google. The staff printed her post for the hospital's wall of fame. 15. A man who woke up after anesthesia complained that the anesthesiologist failed to give him any dreams. He said he expected at least some fun visual effects for the price he paid and called the experience boring darkness. He suggested hospitals offer a dream selection menu before surgery so patients could choose their unconscious entertainment. The anesthesiologist laughed so hard he had to sit down. The man insisted his complaint was serious, saying the lack of creativity showed poor customer service. He ended the form by writing 0 stars for imagination. The nurse taped it above the break room coffee machine. 16. A patient claimed her doctor was unprofessional for using fancy trick words, like inflammation and prognosis. She said he was clearly trying to confuse her and make her feel stupid. She demanded that all medical staff use normal people language like swelling boo-boo instead of inflammation. She also said outpatient sounded elitist. When the staff tried to explain that these are standard medical terms, she accused them of gatekeeping knowledge. Her complaint ended with a recommendation that doctors take vocabulary sensitivity training. The physician wrote back politely saying, "We'll do our best to keep the boo-boos simple." 17. An elderly man filed a complaint that his motorized hospital bed was too complicated. He said the multiple buttons gave him performance anxiety, and he missed the days of simple crank handles. He wrote that technology was ruining the comfort of being sick and that he didn't want to feel like a pilot just to take a nap. He requested a downgrade to a manual bed, claiming he would heal faster without the stress of automation. The nurse adjusted his bed with a single button to show how it worked. He glared at her and said, "See, it's mocking me." 18. A woman recovering from a minor procedure complained that her hospital dessert was visually offensive. She said the red gelatin was clearly cherry and not raspberry, which clashed horribly with the green plate it was served on. She described it as culinary trauma and said hospitals should respect color harmony. She never mentioned taste or nutrition, only presentation. The food service manager apologized out of politeness, but kept a copy of the letter to show new hires what real pettiness looks like. She ended her complaint saying a healing environment should include visually soothing desserts. The kitchen staff laughed for 10 minutes straight. 19. A patient hearing a code blue announcement pressed the nurse call button to complain that the phrase was too negative. She said hearing the word blue made her sad and anxious. She suggested the hospital replace it with something cheerful like code sunshine or code happiness. When the nurse tried to explain that it signals a cardiac emergency, she said the hospital could save more lives if everyone just stayed positive. She ended her letter insisting that better vibes lead to better outcomes. The nurse read it aloud in the break room and everyone nearly fell off their chairs laughing. 20. A man received a long hospital bill after a complicated surgery, but his only complaint was about the paper quality. He said a life-changing amount of debt should at least arrive on thick luxury cardstock. He claimed the cheap paper made his suffering feel undervalued. He even included a sample of what he thought medical billing paper should feel like, describing it as substantial yet tender. The finance office had to confirm it wasn't a prank. His complaint ended with, "If you're going to bankrupt me, at least do it with class." The accounting team agreed he had expensive taste. 21. A woman refused to take her prescribed pills because they were oval-shaped. She said round pills looked trustworthy, while oval ones felt deceptive and sneaky. She claimed the shape indicated corporate manipulation and demanded circular alternatives. The pharmacist patiently explained that shape doesn't affect function, but she accused him of participating in pharmaceutical geometry fraud. She said real medicine should be symmetrical and wholesome. When offered liquid form, she declined, saying, "Liquids are worse, they have no integrity." The doctor made a note in her chart reading, "Allergic to shapes." She later posted online warning others about crooked pills. 22. A patient recovering from abdominal surgery complained that his clear liquid diet was culinary cruelty. He said the broth lacked depth and the lemon gelatin tasted like betrayal. He described himself as a food critic trapped in a hospital prison. When a nurse explained it was temporary, he accused the kitchen of flavor negligence. He asked to speak to the chef about the menu's artistic direction. He ended his letter demanding a refund for emotional starvation and one properly seasoned consommé. Staff now joke that the soup has to pass Michelin standards before serving. He still writes reviews on Yelp about hospital cuisine. 23. An older patient wrote that his doctor's handwriting was too neat. He claimed it looked robotic and lacked human emotion. He said a true professional should have messy notes because good medicine comes from chaos. He argued that legibility showed laziness and that sloppy handwriting was the sign of deep concentration. When nurses praised the doctor for clarity, he said they were covering up for automation. He suggested the doctor attend a creative penmanship workshop to appear more authentic. The doctor framed the complaint next to his medical degree under the title, "Apparently I write too." Well, patients now compliment his cursive out of irony. 24. A man in the waiting room filed a formal complaint about the other patients. He wrote that one man's breathing was arrogant, a child's laughter mocking, and an elderly woman's perfume offensively cheerful. He said the hospital should screen patients for personality before admitting them. The receptionist asked if he wanted to wait outside, but he insisted on comfort indoors. When his turn came, he said the doctor's smile was also too confident. His report concluded that the entire facility lacked ambiance control. The staff pinned his complaint to the wall under a sign reading, "Patient of the Month." Everyone silently agreed it was performance art. 25. A patient demanded to see management because his nurse asked if he had any allergies. He considered the question deeply offensive, claiming it implied his body was defective. He said he took pride in being biologically elite and that the question diminished his genetic accomplishments. He wrote that nurses should find more respectful ways to gather medical data, like asking if you have any superior traits. The nurse apologized politely while fighting back laughter. His official complaint ended with, "Don't project weakness onto me." The doctor added a note in his file reading, "Immune to humility." The entire staff still quotes it weekly. 26. A woman recovering from surgery filed a complaint that the nurses were too efficient. She said they came in, checked her vitals, replaced her IV bag, asked if she needed anything, and then left. She felt ignored because they didn't stay for casual conversation. She wrote that being treated like a checklist item made her feel spiritually unseen. When told that nurses had multiple patients to care for, she said hospitals should schedule social time as part of recovery. She ended her note saying, "Compassion means staying to gossip a little." The nurse reading the complaint sighed, smiled, and quietly added it to the growing collection of classics. 27. A professional musician filed a complaint that the beeping of his heart monitor was musically off-key. He said the tone was a quarter step flat and caused him emotional distress. He claimed the dissonance interfered with his healing process and demanded the hospital retune the equipment to concert pitch. When staff explained the beep was for safety, not melody, he said hospitals should care about harmony too. He even brought a tuning fork to prove his point. His complaint ended with a list of suggested musical notes for medical devices. The technicians joked about starting a hospital orchestra just to satisfy him. 28. A patient was told to take it easy after hernia surgery and took the advice to an absurd level. He returned weeks later weaker than before because he had refused to move at all. He said he thought take it easy meant achieve total stillness. When told he needed gentle activity, he accused the doctor of giving unclear instructions. He wrote that doctors should use precise language like be lazy but not too lazy. His complaint ended with the statement that words have consequences. The surgeon said he'd never met anyone who treated bed rest as a full-time career. 29. A man preparing for a minor procedure recoiled when his doctor entered smelling faintly of antiseptic soap. He said the scent was harsh and unnatural, and filed a complaint claiming that over-cleanliness made him uncomfortable. He said real professionals should smell earthy like trust. When staff explained hygiene standards, he said sterilization was fear-based behavior. His complaint ended with a demand for a doctor who smelled human. The infection control officer nearly passed out laughing. From then on, the nurses referred to him as the natural fragrance advocate. Ironically, his next visit was for an infection. 30. A patient furious about hospital food quality called his broth soulless and his gelatin existentially bland. He said being forced to eat such uninspired meals delayed his healing. He demanded the hospital hire a Michelin star chef and offer wine pairings with lunch trays. He even rated his soup 1 star on Yelp. When staff reminded him it was a medical facility, not a restaurant, he said good flavor is universal health care. His complaint ended dramatically with the line, "No one recovers on bad stock." The kitchen team framed it and called it their unofficial slogan. One cook joked about printing it on aprons. 31. A patient refused treatment from his bearded doctor, calling facial hair a germ hotel. He said whiskers could harbor diseases and made him feel unsafe. He wrote that hospitals should enforce strict shaving policies to prevent microbial terrorism. When told that beards can be clean, he accused the medical board of ignoring basic hygiene. He asked for a smooth-faced doctor and refused to be seen otherwise. His complaint concluded with, "I can't trust a man who hides his intentions behind follicles." The doctor stroked his beard thoughtfully and said, "Well, I can't argue with poetry." Everyone laughed for days. 32. One elderly woman treated the emergency call button like a concierge service. She pressed it constantly for pillow fluffing, television channel changes, and crossword help. When nurses politely reminded her it was for emergencies, she accused them of poor customer service. She wrote that hospitals should value luxury experiences for patients and not limit access to comfort. She said pressing the button gave her joy, and that restricting it was emotional cruelty. The staff eventually unplugged it from the wall to maintain sanity. Her complaint ended with, "I expected a spa, not a prison." Nurses still quote it during night shifts. 33. A woman recovering from a mild infection filed a serious complaint that her doctor's stethoscope was too cold for modern medicine. She said with all the advancements in technology, forcing patients to endure a chilly metal disc was a violation of comfort rights. She demanded hospitals upgrade to temperature-controlled stethoscopes, or at least pre-warm them in a pocket. When the nurse explained that the device had to stay clean, she replied that empathy is more sterile than alcohol wipes. She ended her note declaring the cold stethoscope ruined her trust in the healthcare system. The staff now jokingly keeps one stethoscope in a microwave marked for delicate patients. 34. A man prescribed antibiotics called the clinic furious that his medication didn't make him sleepy. He said the label said, "may cause drowsiness," and he expected it to fix his insomnia. He accused the pharmacy of false advertising and said the medicine failed to meet expectations. When the pharmacist explained it wasn't a sleeping pill, he said, "Then what's the point of side effects?" He suggested the hospital create a dual-purpose antibiotic that kills both bacteria and boredom. The pharmacist quietly muttered that he should try reading the instructions next time. His complaint was later pinned up under the heading, Expectations Management. 35. A patient staying 3 nights in the hospital filed a formal complaint about the name of the free Wi-Fi. He said, patient guest access sounded cold and impersonal, making him feel like a number instead of a soul. He proposed renaming it to Healing Hotspot to encourage positivity. He insisted that connection quality directly impacts emotional recovery. The IT technician who read the email laughed so hard he dropped his tablet. The hospital didn't change the network name, but they did briefly rename the staff network Empathy Central as a joke. He later bragged that his feedback had transformed hospital culture forever. 36. During a routine reflex test, a patient panicked when the doctor tapped his knee with a small rubber hammer. He shouted that the doctor was activating his fight response and refused to continue. He claimed the instrument was a violence stick and demanded it be banned. When told it's a harmless diagnostic tool, he said cartoons never lie and that hitting knees causes chaos. His complaint accused the doctor of weaponizing limbs against their owners. The neurologist laughed until tears rolled down his face. Nurses now call the reflex hammer the forbidden object whenever he comes for checkups. 37. A man who just came out of anesthesia demanded to speak to hospital management because he woke up wearing an oxygen mask that clashed with his skin tone. He said it made him look pale and washed out in post-surgery photos. He called it aesthetic malpractice and suggested hospitals should offer masks in a range of fashionable colors for self-expression. When told the mask wasn't a style choice, he said, "Then why does it ruin every selfie?" He insisted future patients should get oxygen couture. The recovery nurse took a picture of his complaint form and sent it to the group chat labeled Priorities of the Year. 38. A woman having her wrist x-rayed was horrified when shown the scan. She said her skeleton looked unflattering and accused the technician of taking it from a bad angle. She demanded a retake, saying her clavicle looked weirdly thick. When told x-rays don't have flattering angles, she said all pictures do if you care enough. Her official complaint said the technician should study photography to improve composition. She left the room muttering that her bones don't normally look like that. The staff nearly cried laughing and labeled her file aesthetic concerns. She later returned with makeup applied for her follow-up scan. 39. A patient accused the blood pressure cuff of having an attitude problem. He said the tightening around his arm felt passive-aggressive and emotionally hostile. He wrote that hospitals should invest in friendlier, more compassionate cuffs that give supportive hugs. When staff tried to explain it measures pressure, he said pressure doesn't have to feel judgmental. He rated the machine's bedside manner as poor. Technicians later added smiley stickers to all cuffs just to amuse themselves. When he came back months later, he told them the new ones seemed slightly more understanding. The nurse nodded, proud of her diplomatic equipment. 40. After being given a walking boot for a broken foot, a patient complained it didn't match his formal wear. He said the gray medical boot clashed with his tuxedo and ruined his wedding photos. He demanded the hospital provide black or patent leather versions for elegant emergencies. When told it was purely functional, he argued that medical fashion is still fashion. He wrote that saving lives shouldn't come at the cost of style. His complaint concluded with, "Medicine should heal without compromising aesthetic integrity." The orthopedist offered him a Sharpie. He said that would be offensively casual. The staff still laughs about it. 41. A man received an itemized bill for his week-long hospital stay and fixated on a single $7 charge for non-slip socks. He wrote a furious complaint, calling it corporate robbery in cotton form. He said he could buy a dozen pairs at the dollar store and that hospitals exploit the sick with sock inflation. He was perfectly fine with paying thousands for surgery, but declared the sock fee unforgivable. He demanded a full refund for the socks, or he'd return them freshly washed. The billing clerk laughed so hard she nearly spilled her coffee. To this day, the finance team calls any petty billing argument a sock situation. 42, a woman screamed in outrage when her surgeon marked her arm with a sterile pen before a small operation. She later wrote that the doctor had graffitied her skin without consent. She said she was horrified that medical professionals vandalize people before cutting them open. The nurse calmly explained that marking prevents mistakes, but the patient insisted she preferred the surgeon rely on intuition, not doodles. Her official complaint described the experience as emotional tagging. She ended by suggesting the hospital invest in invisible ink. The surgeon printed the letter, framed it, and hung it in his office under the title Modern Art in Panic. 43. A man was told his blood pressure was dangerously high and immediately accused the machine of lying. He said he was a calm, chill person, so high readings were scientifically impossible. He argued that blood pressure measures personality, not biology. When the nurse tried to explain how it worked, he said, "I'm too relaxed for hypertension." He demanded a retest after doing a short meditation video. When the results were still high, he claimed the cuff had bad vibes. His complaint ended with, "Your machines are emotionally biased." The doctor suggested switching him to decaf. He replied, "Don't tell me how to live peacefully." 44. In a packed emergency room, a man with a sprained ankle threw a tantrum because someone in cardiac arrest got treated before him. He shouted that he had been waiting longer and accused the hospital of ignoring the sacred first-come, first-served rule. He compared the situation to being cut in line at a deli counter. When the nurse explained triage, he said, "So heart attacks get VIP passes now?" He threatened to call customer service for justice. His complaint letter ended with, "I demand equality in emergencies." The staff printed it for their break room under the label, "When Logic Flatlines." 45. After hernia surgery, a man complained of severe pain and blamed his doctor for unclear instructions. He admitted he had been walking his 120-pound dog every day, saying, "I didn't lift him, he just pulls me." When told that still counts as strain, he accused the medical team of using vague language. His complaint said, "If you meant no giant dogs, you should have said that." The surgeon laughed for a full minute before writing a reply that simply said, "Noted." The patient later returned for a checkup with his dog still in tow. Nurses now call him the leash lawyer. 46. A woman recovering from surgery said her IV pole ruined her room's energy. She described it as a cold metal tree of sadness that threw off her aesthetic. She said its squeaky wheels were emotionally damaging and disrupted her healing vibrations. She suggested hospitals replace IV poles with handcrafted wooden ones, or at least something with fairy lights. When staff explained the pole was functional, she said healing is 50% decor. Her complaint ended with, "Wellness requires ambiance." The maintenance team added her letter to the Creative Design Feedback folder. They later nicknamed her the Feng Shui patient. 47. A doctor received a complaint from the wife of a patient who was angry that the physician spoke directly to her husband instead of her. She said she was the one managing his diet and medication, so she should be addressed as the project manager of his body. She claimed the doctor's behavior was disrespectful to her leadership role. She ended her letter saying, "Communication chains must be respected." The doctor read it twice before asking if it was satire. When he shared it with colleagues, they laughed for hours. The nurses now jokingly refer to her as the CEO of recovery. 48. A woman diagnosed with shingles complained that the name sounded cheap and undignified. She said it made her illness sound like a roofing problem and demanded a more elegant medical term, preferably French. When told it's a nerve condition, she said, "Then call it something classy like neural couture." Her complaint ended with, "How can I suffer gracefully with such a ridiculous name?" The doctor simply wrote back, "Merci." 49. A patient complained that his hospital blanket was emotionally inconsistent. The first one was too heavy, the second too light. He said nurses were playing thermal roulette with his comfort. He wrote, "Is it too much to ask for a blanket with emotional balance?" The nurse eventually handed him both blankets and said, "Choose your destiny." he rated the service lukewarm. 50. A man hated that all the nurses wore identical blue scrubs. He said it made him feel like he was trapped in a sad medical cult. His suggestion was themed days: Hawaiian shirt Monday or sparkle scrubs Friday. Management thanked him for his colorful vision. The nurses now occasionally wear mismatched socks in his honor. He called it a start toward healing. 51. A man in a private room facing east demanded relocation because the sunrise was too aggressive. He said mornings were assaulting his peace. He asked for a west-facing room with gentler afternoon light. When told no rooms were available, he muttered, "So the hospital sides with the sun." Nurses now use sunlight emergency as code for drama. 52. A patient panicked after receiving lab results online before the doctor called. He said hospitals shouldn't ambush people with raw data. He claimed numbers need emotional context. He suggested results should arrive with a therapist or at least confetti. His complaint ended. "I want my cholesterol news to feel supportive." The lab team renamed his file Fragile Data Delivery. 53. A man told to follow a low-sodium diet proudly reported perfect compliance because he stopped using a salt shaker. He still ate pizza, soup, and chips. When his blood pressure skyrocketed, he blamed unclear medical communication. His complaint demanded plain English like, "Avoid salty stuff entirely." The dietitian said, "That's exactly what we said." He responded, but not with feeling. 54. A woman saw a family photo on her doctor's desk and filed a complaint saying it distracted him from her sinus infection. She said personal happiness shouldn't interfere with patient care. She demanded emotional neutrality in decor. When asked what decoration she preferred, she said, "Maybe a painting of despair." The doctor kept the photo and added one of her complaint letter beside it. 55. After being revived from cardiac arrest, a patient said the doctor yelled "clear" too loudly. He called it unprofessional energy. He said life-saving procedures should be done calmly and with spay-like tones. His complaint ended, "Next time, whisper life into me." The doctor laughed, saying, "We'll try inside voices during defibrillation." The patient rated the experience 3 stars for volume. 56. A man furious about a hospital parking fee said the gate machine was emotionally manipulative. He claimed paying to leave after being healed felt like redemption tax. He demanded free parking for spiritually improved individuals. When told it funds hospital maintenance, he said, "So my gratitude pays for asphalt?" The attendant smiled and waved him through, saying, "Consider it divine forgiveness." And that concludes the 56 dumbest, wildest, and most unbelievable complaints ever made about doctors and nurses. From cold stethoscopes to fashionable oxygen masks, we've officially diagnosed humanity with terminal stupidity. Which complaint made you laugh or lose faith in society the most? Drop it in the comments. Hit like if you made it through without filing your own complaint, and subscribe for more hilarious tales from the world where logic flatlines.